Hi everyone, my name is Allison Warren. I'm the Multimedia Public Relations Specialist here at Sarasota Memorial Hospital. As the COVID-19 pandemic continues to affect our community, we've received so many questions from parents about their children going back to school soon and what they need to do to keep their children healthy. Joining us today to discuss these questions is Dr. Manuel Gordillo, the Medical Director of SMH Infection Prevention and Control, and Dr. Deirdra Myers, a pediatrician with First Physicians Group. Thank you both so much for joining us.
Thanks for having me.
Happy to be here.
Dr. Gordillo, the first question on every parent's mind right now is it safe to send my child back to school?
It's a great question. Schools are essential as grocery stores, as doctor's offices, as hospitals, and they are a bedrock of American society. So it is extremely, extremely important to keep the kids going to school and keep the schools open. I don't think there's any controversy about that. You know, schools are much more than just a place for kids to go and learn, but there has many other functions, and it's vital for society to continue to work. So it behooves all of us in government, in society, in communities to keep schools open. The real question is, when is it safe? And there's really limited data for that. You know, the data that we have is derived from other countries where the situation with COVID is very different than we currently experiencing in Florida. So Florida has one of the highest prevalence in the world today. So the models that we have are all taken from societies where the prevalence of the disease is much lower. So the question becomes, is it safe, as you said? You know, it's a big question. So I don't think it has a right or wrong answer now. I think most of us think that the prevalence in Sarasota, in Florida, in this area is too high to say that we can safely start that. But it's an unknown, it's a largely unknown, and it really will take all our wisdom and all our creativity and all our flexibility to do it right. I think the government had noticed that and then decided to postpone the opening from the beginning of August to the end of August. But is it enough time to make it safer? And it's probably never going to be a safe time. You know, during a pandemic, there will be no safe time. There will not be a perfect time. There will just be a less bad option. But we need to consider that kids have to go to school. And in order for society to start functioning or to have any semblance of functioning, we need to get the kids in school. With kids at home, it's not going to be anywhere near any semblance of normality. And kids will suffer.
Dr. Myers, as a pediatrician, I'm sure you're hearing this question a lot from parents. So to that same end, what are you telling parents who ask you if they should send their children back to the classroom?
Right. This is undoubtedly one of the most difficult decisions that families have to make. And as we know, and as Dr. Gordillo also said, the benefits of school goes beyond academic instructions. And school also offers and provides critical services to help the students learn social and emotional skills. They offer occupational, speech therapy, as well as behavioral and mental health services. They provide reliable meals. School supports parents and caregivers by providing a place for their children so that they can continue to work and be economically productive and support their families. And these include essential workers such as us, healthcare workers, who continue to provide vital services to the community. We recognize that prolonged time away from school can pose negative effects, and this disproportionately impacts the vulnerable children. So children with disabilities, those who really need the school-based health services, those who have limited access to reliable technology, those children who rely on school meals. So what we tell our families that we take care of is that each family has different needs, and there are numerous factors that we have to consider particular to your own family. So one of these is the level of community transmission, which is also vital. Although most children appear to do well, the risk is not zero. They also have to consider the health status of each family members. Although uncommon, some children can be at risk for severe illness if they contract COVID-19, but there's still a risk. Some of them also live in multi-generational homes with relatives who can be at high risk. We also have to consider the family's work situation, their support system and resources, as well as the children's educational and health needs. A lot of things to consider when we discuss this with families.
That's a great point. Dr. Gordillo, it's not just the parents of school-age children who are concerned. There are college students going back to school soon as well. And some students have classes online now, but some are going back to the classrooms. And they're going back to the dorm rooms as well. So the question is it safe for them to come home from college and visit their families on weekends or during school breaks? Or do they need to quarantine for the safety of themselves and their parents?
Yeah, and just like schools, higher education has their own set of problems. Now we're dealing with adults, younger adults for the most part, which are equally susceptible than older adults, but good part is that they generally don't get as sick as the older adults. But then there's going to be transmission, and obviously there are staff that work at colleges, and they're equally susceptible to like the younger folks. But then they have, because of their older age, they are susceptible to their propensity to have a more malignant disease is much more of a major problem. So then each location, each state, each college is different too. They have different populations. The composition of age groups are different. The population at risk is different. They have people with different diseases and different disabilities. The infrastructure is different. The size of the schools are different. So there's so many things that each school need to consider individually. So some schools will open with a lot of online distance learning. Some schools will do a hybrid, and some schools will go just like a full opening. But each one will have their own challenges, and obviously full opening will be the most problematic. And that's where you have those type of issues that you just mentioned. When the cases occur, when do you quarantine them? Or when there's even no cases, when they go back to visit their parents at home or their families at home, what do you do? So there's no single answer for all the situations. Obviously, you have to individualize. It depends on who is at home. What is the risk of the folks when they return home? Obviously, it'll be different if you have a parent having cancer or chemotherapy than a perfectly healthy, relatively young parent. So it will have to be individualized. There's no one size fits all, and there's going to be a lot of individualization in the decision making.
Do you have concerns that the dorms will serve as kind of vectors for this virus?
Yes, there's obviously that concern, and there's a whole variety of type of dorms. The larger ones that where there's high density, obviously will be the highest risk, and those are the most problematic, and probably the ones that the schools were try to modify that, to move it from that high density situation to a lower density. But how specifically will they do that is still something that each school will be deciding. But definitely the higher the density and being indoors, it will be a high risk.
Dr. Myers, what are some of the other questions you and the partners in your pediatrics practice are hearing from concerned parents?
Yes, some parents have called us with concerns about high-risk family members, such as high-risk siblings with complex medical conditions or weakened immune system. And we try to guide them and navigate through this process, because these concerns are valid. And like what Dr. Gordillo said, it's going to be individualized.
And what about mask wearing? How can parents help their child to properly wear a mask and help them adjust to wearing it for those long days in the classroom? What are you telling the parents you see?
Right. First, we have to open a conversation with our children about what is COVID and why we need to wear a mask. This can be done in simple and fun ways, such as visual activities, coloring books, videos. There's a lot of resources like these. When it comes to masks or face coverings, we have to help them build sort of a mask endurance or mask tolerance. We can, make or purchase those that are designed with their favorite characters or movies. We can try having them wear these masks while doing their favorite things or favorite activities, like playing with their dolls or playing with their Legos, and increase time. And also, wearing face coverings or masks can be hard for children to maintain, but we can practice at home as soon as possible and build tolerance over time. The children may not be able to do each preventive strategy perfectly, such as wearing face coverings, physical distancing, and hand washing. But when we implement them together, overall, it will help.
Dr. Gordillo, what offers the best protection for kids? Is it the face masks or the face shields?
Well, we don't know which one of the two is better. In general, there's a lot more experience with masks than with shields, but in the countries where they've been going to school already, they've been trying face shields for certain situations. The advantages is that in terms of communication, especially for children, there's a lot of nonverbal cues that the face shield is important. Having worked in hospitals, sometimes I can tell how difficult the communication can be when you're wearing a face mask and you're not used to see the lack of expression or the lack of the mouth movements. That is very important. It gets missed when you're wearing a mask, and the shield can overcome that problem. Also, for people that are hearing impaired, for example, it's very difficult because they need to read the lips. So there are other advantages as well for the face shields. For example, it doesn't allow you to be touching your nose, your mouth, your eyes, and in certain situations more comfortable. But there's a lot less experience worldwide with the use of shields. So I think, in my opinion, there should be a combination of both, availability of both, and like it was said, with mask you can also introduce fun things, like designs and things like that. I've seen that the same occurring in the face shield world, where they're starting to come up with innovative designs and make it attractive for the children.
So Dr. Gordillo, there have been some reports of COVID-19 deaths in children, but they seem rare. Can you help us understand the risks to a child versus adults who are exposed to a child they may spread COVID-19 to?
Okay, so there's several aspects to this. And one we didn't know a whole lot which is, can a child transmit the disease to others, just like an adult can transmit to another adult? That the initial data from China seemed to suggest that they didn't. But it was limited data, small groups, and then we started to see the same thing being reported from other countries. And then a couple of weeks ago, South Korea published their largest experience, countrywide, and they seem to find the same thing, especially young children between ages 1 and 10. They don't seem to transmit as much as older children or adults the disease. And also, they may be less susceptible to acquire disease. Why is this? It's not clear. They could be. We know that they may have less density of the receptors in the cell. There's something called the ACE receptor. So they may be able to be less receptive to the virus. But there may be other factors as well. I mean, they're shorter, they're closer to the ground. So when they speak, the droplets fall to the ground faster. Their mouths are smaller. Their voice is not as deep, or they cannot propel the droplets further out. But there may be other factors. So the bottom line is they do not transmit as much as older children or adults. And then they do get sick, but when they get sick, the disease is much milder than in other age groups. So that is a good thing about the youngest of the children. Between 1 and 10 probably, they tend to have milder disease than older children, or transmit less as well.
So you sort of just touched on this, but what do you say to people who ask you about these kind of concerns that kids are going to go back to school and become these super spreaders at home?
So we don't, this type of problem has happened with influenza and other viruses, where the kids are the ones that bring the virus to the home. The kids are the ones that are spread the disease to the rest of society, but not in this. It doesn't seem to be the case in this particular coronavirus. They're not the super spreaders. For the reasons I mentioned, it seems that they are definitely less prone to get the disease, and they're not as uh, bad as vectors as they are for some other respiratory viruses.
Thank you. Now, Dr. Myers, even if we weren't in the middle of a pandemic, parents are always worried about keeping their kids healthy throughout the school year. So is there anything parents can do now to increase their child's chances of staying healthy throughout the school year? Are there any immune boosters you recommend? Or is it really mostly proper diet, consistent sleep, and hand hygiene?
We recommend that children eat a good variety of foods that contain important nutrients, vitamins and minerals, drink enough fluids. Getting enough restful sleep is also important. Having a good sleep routine is very helpful. Turning off screen at least 1 hour before bedtime. Having a sleep supportive bedroom. All of these will contribute to a healthier immune system, and also learning proper hand washing, as they will need to do this frequently.
So do you recommend to parents that weeks ahead of school starting, they implement some of those things if they've let the bedtime go a little later during the summer and things like that?
Yes, we have to start early, trying to go back into a routine.
All right, thank you. So Dr. Gordillo, if children are going back to the classroom and parents do make that choice, what steps can they take when their children get home to reduce the possibility of transmission in the case their child might have been exposed?
Well, the things that we recommend for adults are also valid in children. Hand hygiene, cover your cough. They need to be educated on those things. Don't try not to touch your mouth, your nose, your eyes. Those are the things that we need to teach the children and remind them all the time. Then there's other things that parents can do for their children. They need to keep them do not congregate. Don't bring children from outside to be hanging on with them, especially if they're not the ones that they usually have there in their small bubble, so to speak. So those are basically the same hygienic measures that we have recommended for everybody, also apply to the children. I don't know if you have any other particular issues that you might want to bring up from a pediatrician's point of view.
It gets difficult for children to stay away from each other. They like to play and congregate and hug. And we just, like you said, we just have to constantly remind them and practice early too. We have to start doing them now and work our way up, like especially with, using masks. It's going to be difficult. Sometimes we may have to go for short walks with masks on or face coverings on to help them get used to it. It's going to be a challenge.
And Dr. Gordillo, some parents have been asking online and such if you need to have your kids take their shoes off in the garage or their clothes, like we've seen some healthcare workers doing, showering when they first get home from school. Are you recommending any of those things?
I think that just regular hygiene is okay. I mean, obviously, if they're soiled, everybody needs to be doing that, adults, children, everybody else. Um, but yeah, I think we don't need to do anything special. We're just going to school. We're not going to go take care of patients in a COVID ward. So I think the regular hygiene is probably enough.
Okay, thank you. Dr. Myers, are there any other important things you try to stress to parents these final weeks before kids return to school?
Yes, this is a difficult time and they are all doing their best. The parents and caregivers should take some time and take care of themselves as well, because their own well-being is very important to the overall health of children. Also, we need to communicate with our children and help them understand the current situation and why we need to protect ourselves. We can start by asking them what they already know or understand. We have to let we have to let we let us give them the time and space to express their feelings as well. We will be surprised with how much they know, and then go from there.
Dr. Gordillo, vaccinations. We know there isn't a COVID-19 vaccine yet, but should children still be getting the flu shot come October, or is there concerns it might weaken the immune system?
No, absolutely. This probably is going to be the most important thing in terms of vaccinations in years. It's going to be critical that everybody gets a flu vaccine this year, or as many as they can get, as they don't have any contraindications. But the more vaccination we get this year will be the better. We need to minimize other viruses. We don't know the interactions between this virus and influenza. When it came last year, it was towards the end of the influenza season, so the interactions between those viruses are not known, but I can guarantee they're not going to be good. And also, we need to try to decrease the amount of other viruses that are circulating, because it can be very disruptive when you start having other viruses plus COVID. It'll be very difficult for schools to manage and for pediatricians and family practitioners to manage that particular situation. So the best thing to do is prevention. And the CDC and the American Academy of Pediatrics already are saying to everybody, vaccinate and vaccinate early.
Dr. Myers, parents who are sending us these questions still seem unsure of their decision, whether it's going to be distance learning or sending their child back to the classroom. You mentioned that it's a very individualized approach. So how are you and the partners in your practice helping parents make that choice without telling them one way or another what to do?
It is a complex process, and to facilitate this, CDC actually came up with a back-to-school decision-making tool for families, and I have it right here. And we'll also provide that link. So it's sort of a checklist, and the questions in these tools are designed to help us weigh the risks and benefits of these different educational options for them. And that, if it states there that if you have multiple checks on the unsure or disagree columns, then that may warrant more conversation with school administrators or possibly your employer, or reach out to your pediatricians or other healthcare providers. We also have to review the school's mitigation strategy. We have to familiarize ourselves with that. And whichever the family chooses to do, we recognize they are trying to do the best they can for their children and their families. During this time, a lot of things are uncertain.
Yeah, and during this time, a lot of people have put off elective or checkups, medical care, things like that. Are you recommending that parents bring their kids in for their checkups before they do go back to school?
Yes, we do recommend for the children to be brought for wellness check, because wellness check allow us to detect abnormalities and that otherwise will be, not detected and may lead to complications sometimes. It also gives us opportunity to give anticipatory guidance to a family depending on the age group of the children. Also give us the opportunity to update them on their needed immunizations. So we do recommend them, and we are all taking precautions when it comes to seeing the families in our offices.
Great, thank you, Dr. Myers. Dr. Gordillo, what about extracurricular activities? Whether it's young school-age children or college kids, they might be involved in sports, dancing, clubs. Do you have any advice for parents when it comes to those extracurricular activities?
Yeah, so again, for young children, this is critically important to socialize and to get those type of activities. Then how do you mitigate the risk? And again, there's a variety of sports, a variety of clubs, a variety of situations, and each one will be different. But in general, outdoors is better than indoors. Small groups, better than large groups. And you just need to emphasize also the need to clean the equipment, keep all the frequently touched surfaces clean. Those are going to be very important things to do. In some sports, masks are recommended. In some sports, there's a lot of sweating that will be difficult. So that's I think that you can mitigate the risk in certain situations. There will be risk sports or some activities that will probably be very difficult to effectively mitigate the risk.
And Dr. Gordillo, before you spoke about how parents can stay safe, utilizing the hand hygiene and things like that if their kids are going back to school, what about teachers? Do you have any recommendation for teachers as to how they can stay safe in the classroom?
Yeah, so wearing a mask is going to be critical for them. And if they cannot, if another issue that has come up is what about other, like the eyes, are they protected enough with the mask? So the face shield could be a supplement too. Then physically distancing, there are some things that schools can do, add plexiglass to give them some extra barriers. But important thing is also what activities they do among themselves. For example, when they get a break, what do? Do they go and socialize with the other teachers, with the other staff? And those are potentially dangerous in problematic situations when they get into a small break room and then they let their guard down and they take out their mask and have a conversation because they're tired. So those are things that are to be avoided. Same thing, try not to congregate to have lunch, because at that time you end up getting your mask out just as a necessity. So those things are important. The other part is that if you're sick with symptoms, you stay home. Sometimes try to rationalize our symptoms, try saying, oh, I just have an allergy, I'll come to work. And then 2 days later, you have a fever and it wasn't an allergy, it was COVID starting. So if you get symptoms that are new, that are compatible with COVID, please stay home. Try to avoid that situation because it's very volatile. So those are, the hygienic measures, and then be careful with the physical distancing, especially during some critical activities, and then stay home if you're feeling sick.
Dr. Gordillo and Dr. Myers, you've helped us answer a lot of these questions. It seems like it's a very complicated issue, and I'm sure we could spend hours on this Zoom call talking just about back to school. So Dr. Myers, is there anything else you think we've missed that you really want to add?
Yes, I just, wanted to say that we all want to promote the overall health of all children while protecting them, the teachers, the school staff. And if each one of us is committed to make efforts in decreasing our community spread, this can help the schools safely reopen and stay open.
Dr. Gordillo, anything else you want to add?
Yeah, we know the risks of not opening the school. we don't know the risks of opening the schools, and it's going to be very difficult to decide when is the best time. I think we need to support all the folks that are making those decisions, the parents, the teachers, the school administrators. The last thing they need to be is to be criticized for decisions that are made. They're doing it the best they can. They're making their best decisions. So whatever they make, I think they need to have our support, whatever their decision is. I think this is going to be very important. We need to all work together. I've said it many times before, solidarity in this pandemic is critical, and we need solidarity from everyone.
Dr. Gordillo and Dr. Myers, thank you both so much again for helping us get some of the answers to these many questions we've been receiving from parents. For more information about COVID-19, we encourage everyone to visit smh.com/COVID-19 and smh.com/blog. Stay safe and stay healthy, everyone. Wear a mask. Have a great day.